Siku ya leo ni siku ya muhimu ulimwenguni. Ulimwengu unapoadhimisha siku ya fistula. Na siku hii tunatathmini zile hatua ambazo tumepiga dhidi ya ugonjwa huu. Mabibi na mabwana, wageni wetu waheshimiwa, karibuni sana katika hafla ya siku ya leo. Kwa ruhusa yako, our DG chief guest, we will wish to have a small entertainment, and the first group to entertain will be the KTRH choir. Tafadhali, so karibuni ili muweze kutupatia one item katika burudani. So karibuni sana timu ya KTRH for one special item. Karibuni sana. Okay.
Dr. B on these ladies and gentlemen.
Karibuni sana wageni wetu. Welcome to Gusii Stadium in Kisii County. Tunajulisha kuwa leo ni siku ya muhimu sana. Ulimwengu unaadhimisha World Fistula. Na sisi wote tumeitwa kwa sababu tuna role ya kuplay katika vita dhidi ya ugonjwa huu. Karibuni sana mabibi na mabwana katika hafla hii. So Kisii School KTRH kwa tafadhali kwa haraka. Hatuna muda. Yes. That is fine. Sawa, hapo sawa for that special item. All right. Thank you. So this is our Kisii Teaching and Referral Hospital. As a best practice, we have a choir. And we have the honor to present on this particular day. Thank you, karibu.
Mzalendo, tuitunze afya bora. Tushikamane sote, tuimarishe afya, ni ufanisi wetu kuimarisha afya. Afya bora ni muhimu, tuitunze afya yetu. Vyakula vya kujenga mwili, tuitunze afya yetu. Mazoezi yanajenga, tuitunze afya yetu. Tuepuke na anasa, tuitunze afya yetu. Tunajivunia hatua za afya nchini, kutibu magonjwa kwa njia za kisasa. Maabara, ibuka teknolojia msingi, tuitunze afya bora kwa kila Mkenya. Tunajivunia hatua za afya nchini, kutibu magonjwa kwa njia za kisasa. Maabara, ibuka teknolojia msingi, tuitunze afya bora kwa kila Mkenya. Tushikamane sote, tuimarishe afya, ni ufanisi wetu kuimarisha afya. Tushikamane sote, tuimarishe afya, ni ufanisi wetu kuimarisha afya. Afya bora ni muhimu, tuitunze afya yetu. Vyakula vya kujenga mwili, tuitunze afya yetu. Mazoezi yanajenga, tuitunze afya yetu. Tuepuke na anasa, tuitunze afya yetu.
Thank you very much. That is KTRH Choir. Tunashukuru sana for a very special item. Munaimba vizuri. Si hata mimi uni recruit to the choir. Which voice are you missing so that okay, thank you. That is a story for another day. Tunashukuru sana. Asante. That's KTRH Choir. And at this particular juncture, ningependa nimwalike our Chief Officer Health Services just atukaribishe katika uwanja huu. So, Madam Karen, karibu sana ili uweze kukaribisha wageni wote ambao wamefika hapa siku ya leo katika uga huu. Karibu sana, Madam.
Our MC, guest of honor, His Excellency, and Your Excellency, the Governor, DG of the Kisii County Government, our CC Health, and all protocols served. Good morning. Feel welcome, Kisii County. We are very hospitable people, and that you have seen this morning. We welcome you here, handy, and we really love you. Feel at home and feel wanted. Thank you so much. Take it up.
Thank you very much, our Chief Officer. Makofi kwake tafadhali. Asante sana, tunashukuru sana, na asante wageni wetu. Karibu sana, mjisikie mko nyumbani. So we are looking at the mother and we are saying her health, it's her right, and we are shaping a future without fistula. Tunataka tuhakikishe kwamba kesi zote za fistula tumeweza kuzimaliza katika jamii yetu. So I'm being told, due to public demand, KTRH inafaa iimbe wimbo mwingine. I'm being told. Sio mimi. Mimi nilikuwa nimewapatia chance moja peke yake. Lakini kwa vile mmeimba vizuri, sauti nzuri, good rendition of the composition of the song, I want to give you an opportunity so that you can do it again the way you have always done it. So KTRH Choir, tafadhali, take to the stage. Najua nyimbo ni mingi, wa mnaporomosha nyimbo si haba. Karibuni sana ili mweze kutupa a second item before we give guidance on the next thing to do in the program. So karibuni sana. DJ. Oh, I'm being reminded that the song they should sing is Afya Bora. So I don't know if it's public demand, so kindly to the stage. Thank you. So I will sing the first stanza and the chorus. Karibu sana pastor, as you lead the team. Karibu. DJ. Jeria, quickly. Okay, good. DJ.
Kuchukua kinga, kinga
Thank you very much. Makofi kwao tafadhali. Hiyo ni KTRH. Kwa hiyo tunashukuru sana kwa wimbo mtamu ujulikanayo kama Saratani. Asante sana. This particular juncture, I want to hand it over to our County Director of Health, Dr. Matiko, who will be able to guide us in the next course of the program. Makofi tunapokaribisha daktari tafadhali. Thank you, daktari, na karibu.
Good afternoon, everyone. Your Excellency, the DG, the Chief Guest, the County Commissioner, our partners and other stakeholders here. Welcome to the Goose Stadium for the commemoration of the International Day to End Obstetric Fistula 2025. But I want to focus on the theme for this year's commemoration, which is her health, her right, shaping a future without fistula. And since we are talking about her health and her right, I don't take so much time, but use this opportunity to welcome one survivor of fistula to come and give her account of experience in as far as what we are commemorating today is concerned. Welcome.
Siwa mitungo kwa nimbi ya mori. Mtena wade shide ye mude ntambe sana. Kere nare konyora omwana. Kuru 2007 mpaka nachituku bwena. Marongo mande ngoba kota kisara de baba. Njomora le makoro hai to wale kikutwala. Kere na vete musigo. Na vete chinga kichintambe nilikuwa sana tumbe nilianza kuniuma sana. Nilikaa 2 hours kwa nyumba.
She was taken to Tabaka Hospital. She was done an operation. She never knew she had any problem. She was hospitalized for a period of... She was experiencing leakage of urine. She has undergone several operations. On account of 3. She didn't recover. She came to General. She went to Eldoret. She stayed again 2 years. She had, announcement was on the radio. She gave her a number. She found one sister from KTRH. Sister Christine, where are you? Christine received her, took her to KTRH. She was done surgery. Since she was done surgery that last year, she's now okay. Sister Christine fought for her. Whenever she sees Christine, she sees us as a sister. She was sick until she was stigmatized. The husband left. The husband left. She was under lock and key in the house. She's now okay. Kwake bado hajarudi. She has not gone back to her matrimonial home. Anyone who knows a relative with the same problem, she encouraged that person to come to KTRH for treatment. She's so grateful to each and everyone who helped her recover. May God bless you. Awapatie nguvu na heshima. Thank you so much.
Thank you so much for sharing your experience. And indeed, our guests, in the current practice of medicine, we are moving away from what the healthcare workers think towards the direction where we are shaping intervention approaches based on the lived experiences. So it's no longer experts sitting in rooms and coming up with guidelines, but the patient experience is continually now being integrated in how we approach various medical conditions, and that's why on such a day we have to hear what they have gone through. And there's a part that is important about integration that we challenge all of us seated here, that we have to ensure they're well integrated into the communities, even after undergoing those experiences. Our guests, today being the day for our survivors, I understand they have a skit to further enhance the information that has been shared by our colleague here. So I'll take this chance to welcome our survivors for that particular purpose. And clearly, they are coming in with a very strong message. Don't be scared. It's part of the skit. Security is tight, so don't worry. Karibu.
Kila siku wewe unanisumbua. Hii ni nini? Tukapata mtoto wakachukua kwao. Nani ananipaka mavi? Nakuuliza wewe mama. Mavi ni mama. Sasa ulikuwa unasema ni mtoto ananipaka mavi. Sema haraka.
Aki mimi niko na shida. Ona vile niko na shida. Kati wenzangu hataona. Kimoko mnatigana kimoko mna ya karate kimoko mna
abantu baminto eire najo omusacha buli ochandikite ng'enche kabire ngwakwa mabye ng'enche kabire ye ayinore meri kuba muchoyo ngwakwa mabye ng'enche kabire mukubwandire nangwakwa mabi ayinore njore meri ng'enche kabire mukungo yagende tinkwanja bungima bungi bunobo nakanire nachire konyore gaye nikukupata hapa utajua
ono ninje mbwato muchando kakine kinati baba
banjiri ngi yakoli
kakirigereri
muchando kyobwata
digereri muna macho kako yani nchago yetelio kakiri
yakoli
akitindi kwenda imaga kibono
ninje muchando
akintige yani mbwato muchando fistula bana bagoteba
amacha
ono tima etie senko enda gokona
muchando ingo kwenule
amaene
inje nari kweti bakechafu Ikuna jietari daraja mbiri bakankonya. Okonya bari kakingo kwena bari kana nyakitari urwari
we. Nende daraja chiro baba.
Daraja mbiri nyakitari nero rero ku family Nairobi family.
Ekene kiege kone. Nipete tibesa.
Besa turi ko bari kuno ine shiringi.
No ine shiringi tinga.
No ine nturure ya mapake turasa transport
Akina chande kire.
Genda nyagitari ya bunole iko. Genda imuka bunole ko genda.
Na titire. Na titire. Na titire. Bonti maiti. Umuga konseliri.
Genda nyagitari ya yoro bunoko smart. No chukuna smart lakini.
Timbrati transport.
Ngaki yoro. Ya.
Aki.
Genda bunole iko. Baba ko transport.
Tigangende taratse yo muga kanti ande tete tikondoraga. Tigangende na inche taratsa ngondole gose ningweni wu egere nkonywe tigango ndagenda.
Chandegete kajigoseri omukungu kwewutera maana yijusia mukungu no yo maana lakini kiburiro bwajite gochera chandegete ngenje kabire kwewutera nayi ushone na yora macha kansamba usali mukungu no mundu wengenjo saone kiburiro bwajite gochera.
Ai baba. Ngati bana.
Biyamona sana.
Bana juro smatiga.
Akinde wero.
Wajite nyagitari ko rweli.
Kagenda taratsa mbiri visions wante habete. Ali Nairobi women. Baba bakangweni bosapi.
Ngaki wete.
Karandi na kiyoroti. Yani rero.
Yani injera chandegete mukungu akagenda kwewutera nayi kajikoyora zingende ngayia mechande ndiera ere.
Kai wamwe abangaki.
Biyole baba.
Biyamona sana.
Kakyo kale smart igota. Tawe kana onye mukungu minto. Mukaumira na arari.
Agenda matanga ari sobo to kaumirana.
Ngaki.
Abinjira ngarete.
Yago kwana. Na gwetaneti.
Angarete kongetana.
Mukungu. Oli gotyo kajindoso.
Anyenjira ari gocha.
Oli gotyo kajindoso.
Anyenjira ari gocha emoga.
Yamono.
Ke umugako nakarumuti oyo.
Chandegete.
Sawa.
Mukungu atari gotari. Atagocha ninde mereri.
Kambi yole.
Ke.
Nde wero maetenje no tatontama. Nte na weni gunanya gitari nde buya ligereri. Ligereri yoka ligereri. No bosirigereri. Nkagenda bakanga amaguta, bakange plastiki, esanje gekombe getiko, endage korage.
Karatiga. Nairobi ene yali wajiede. Nairobi ne yali wajiede.
Bosongo.
Nairobi?
Bosongo mata.
Kachikorwali ku Nairobi baba. Bwangere sukurani. Karangwani.
Na kioroti.
Nariko dioka. Mati ke.
Tioroti.
Aje numu yenya sawo liko togende. Togende bintu bile smart. Togende aye. Togende.
Gende binyoro, genda chikanisa, genda chichiro, motevia bangina bonsi, betange na kistura. Gende binyoro, genda chikanisa, genda chichiro, motevia bangina bonsi, betange na kistura. Fistura no borwaire bakoretwa na butando ekera bangina bakoibora.
Asante sana.
Asante sana. Nainwe na baya mwatoko nyira bangina twawenire.
Thank you so much. So for those who are not following, basically the skit was around, kunyanyapa. Kiswahili tuko sawa? Stigma. All right? For those who have fistula, but the lady got intervention, and now that is offered at Kisi Teaching and Referral Hospital. And eventually the husband or the spouse was, shocked, at the change of events. And we've seen them, unite. So let us not hide those who have this problem, but bring them to Kisi Teaching and Referral Hospital so that they get the relevant interventions and follow-up. Having had that session, and without taking so much time, because in the next few minutes I'll be welcoming Karen from the division, I want to use the few minutes that I have to recognize some of our partners who've supported us as a county, but more recognition will be coming in the way of Karen when she stands here. But particularly I want to mention that we've had great support, and if you're around from these particular organizations, you can stand where you are and wave. The National Syndemic and Disease Control Council, we have our partner waving from that end. We can appreciate them as they stand and as we mention their names. The Christian Association of Kenya, CHAK, they could be waving from a place I can't see. Jacaranda Health, Luala Community Alliance, Darajambil Vision Volunteers, the Fistula Foundation, TINADA, International Solidarity Foundation, ISF, Grace Initiative, Kisii University, the Kisii KMTC, Kisii Polytechnic, Kisii School, Enacoach, Unique Supermarket, and the Kisii Mart Supermarket, and indeed all the other stakeholders. I know more names will be coming when Karen is on the floor, and I want to take this opportunity to welcome Karen, and once you're done, you'll hand back to me. Karibu Karen.
Good morning, everyone. Thank you for coming to celebrate with us. All right, thank you. So thank you for coming to celebrate with the Minister of Health. This IDEOF has come and say something. As our donor,
Johnson & Johnson has a long history of improving fistula care around the world. We began donating sutures for fistula surgery to low and middle income countries in the 1980s and worked directly with surgeons and hospitals to address the large unmet need for surgical care. And recently in 2012, we partnered with the Fistula Foundation, Direct Relief, UNFPA, to release the world's first fistula facility map, an important step toward streamlining resource allocation to address treatment gaps. In 2016, we began providing simulated surgical training through a free mobile app that can reach medical professionals globally to facilitate the safe and efficacious use of technologies. We are building on these decades-long efforts to improve and support access to obstetric fistula care for women in sub-Saharan Africa. And to date, we have helped tens of thousands of women receive quality fistula repairs and remain committed to improving access. Since 2021, Johnson & Johnson has supported more than 8,800 obstetric fistula repair surgeries through the J&J Suture Donation Program. We are focused on improving care by developing and providing access to surgical instruments that have been customized to treat women in resource-limited settings. Additionally, we are working with local collaborators to help train surgeons, nurses, and community health workers on the effective use of these technologies. And more particularly to this date, in 2022, we joined JPIGO, our partner over there, and the National Ministry of Health of Kenya to initiate a 3-year obstetric fistula pilot program designed to empower entire surgical teams, from nurses to operating room staff to community health workers, to enhance access to safe obstetric fistula surgical treatment and care across Makueni County. And that's how we came up with the OF playbook. So as Johnson & Johnson provided tools to support safe surgery, that includes sutures, fistula scissors, and other essential tools, and facilitated the training of nurses and community health workers who are bridging the gap between women and the care they need and deserve. Thank you so much for having us.
Thank you, Johnson & Johnson. You are our biggest donor for sutures, and we hope you'll continue working with Kisii County. Next, I have UNFPA as a donor. Kindly come and say, we give you 1 minute to say something small. Thank you, Karibu.
Thank you. And she gave me only 1 minute, so it's very challenging. But thanks, Honorable, for hosting us, and also Deputy Director General, Ministry of Health, and every partner here today to celebrate this important day in which all we come together to end obstetric fistula. And as we saw this morning, there are quite a lot of women in the world, but also we have many other women in the communities that maybe they don't even know that they have obstetric fistula. So at UNFPA, ending obstetric fistula is at the heart of our mandate, and is essential to ensure that women and girls exercise the right to good health, and they can be active agents in their lives, and they can be empowered in their communities. We saw the theater here. I didn't understand all, but I could see that this woman was put aside, and then she recovered her dignity and her agency after surgery. So, and also I want to stress the importance of preventing obstetric fistula by preventing adolescents' pregnancy, child marriage, and ensuring that women and girls have access to family planning. And at UNFPA, we commit to support the Ministry of Health and the partners to make sure that the health providers are trained and there are facilities that are able to provide fistula care and restore the dignity of the women. I will not read my speech because I only was given 1 minute, but I'm very happy to be here, and hopefully we can also see across the country the vision of having fistula repair as a routine service and not only through fistula camps, so we can make sure that any woman at any point in the year she's able to access fistula care services. So thanks everyone, and thanks to the Ministry of Health for leading this important event, and let's make sure that we can end by 2030 fistula in Kenya. Thanks. Asante sana.
Thank you very much, UNFPA. And now we want to call upon our trustee from M-Pesa Foundation. Kindly come and say a word.
Your Excellency, the Deputy Governor, Deputy DG Health, all our partners, everyone here assembled, Mbuya Mure, Mbuya Mure, nitafika tu hapo. Hiyo ndo nilifunzwa saa hii tu. Today, I think, is a day when, as we seek to eradicate fistula in Kenya, we celebrate, first of all, I would say, the power of partnership. Looking at all the partners and all the collaborators here who have made this possible, I think that is the first celebration, that when we work together, we can transform the lives of so many Kenyans. M-Pesa Foundation, since 2010, has been transforming lives in large-scale programmatic interventions in the areas of health, education, environment, and integrated water and livelihood initiatives. Since 2021, we have been especially keen on the area of fistula, and we had our first fistula camp in Bungoma, where we were able to transform the lives of 60 women. In these years, we have done similar camps in 12 counties. Just last month, in September last year, we were in Migori County, where 100 women were treated, and we are targeting reaching 1,000 women by the end of this year. From everything that has been said here today, and from the very, 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 I would say, expressive skit that we watched, we realized that fistula is not only a disease, it's a stigma. It's a condition which comes with so many social ramifications. It's a condition which has the potential to break marriages, to break homes. So today, as we come together as partners, on behalf of M-Pesa Foundation, I would like to thank all the collaborators, to thank the county, the Ministry of Health, and to ask all of us to continue working together to bring more women to receive these services, to bring more women so that we can restore not only the dignity of the woman and the girl in Kenya, but also, as we saw in the hospital today, that we can bring back smiles to their faces. Thank you very much.
Thank you very much. Before I call our last speaker, the donor, let's recognize the presence of Jepaigo. Kindly just stand and wave to us. Jepaigo, as an implementing partner. Thank you, Dr. Daisy. AMREF. Thank you, AMREF team. Beyond Zero. Thank you, Beyond Zero. Flying Doctors. Thank you, Flying Doctors, for being with us. Wadadia. Thank you, Wadadia, for coming together with us. I'll now call upon Fistula Foundation. Musa, kindly come and say a word because you have been on the ground in Kisii County for a very long time. Thank you. Karibu.
Deputy Governor, other leaders who have been invited to this ceremony, Hamjambo. Now I stand here to become part of this celebration. And on behalf of Fistula Foundation, I would like to begin by saying the theme allows us to sit back and reflect on where we are coming from and where we want to go to. Fistula Foundation has been in Kenya from 2014. And if you look at the investments we have been doing in Kenya, they have been strategic to the point that we focus on what we call interventions that can be sustainable beyond the funding we are providing. We invest basically in building capacity of healthcare providers. We invest in supporting facilities to be able to provide what we call routine care. So far in Kenya, we have established 11 treatment centers across the public, which is about 23% of the counties covered. We are looking forward to doing more. Probably by the end of the year, we are hoping we should be able to cover about 30% of the counties. We have trained about 11 fistula surgeons who are supporting and providing treatment. We keep on building the capacity of CHPs to continue mobilizing, and we hope through these interventions we will continue to reach more women and support them to get treatment. Thank you. God bless you.
Thank you very much. Before I hand over the mic, I want to recognize Fistula Women Foundation that donated diapers, 1,000 diapers to our women who came for admission in Kisii. I know with us, but they did a good job to be able to buy for us the diapers for our women. Thank you very much, and thank you for coming to celebrate together with us. Thank you.
Thank you very much. Makofi kwake tafadhali, our director health.
Thank you so much, Karen. That was well run. At this juncture, I want to recognize the leadership that we have here from the county. Maybe generally we can just be upstanding so that people know that we are here. NCC, Chief Officer, other directors. Asante sana. I also want to recognize the principal MTC, who is also a major partner from providing staff take care of our patients and indeed gracing this occasion. So I'll quickly want to welcome my CC to make his remarks and pick the program from this juncture. Karibu Waziri.
Asante sana Dr. Matiko. Your Excellency Deputy Governor, Kisii County Government, visitors from Ngao, represented by the DCC, my friend Joseph Mwangi, MOH delegation that is led by the DG, Mr. Mariga, partners who have been with us since we started planning for this very important event, members of staff, Department of Health, who have been very passionate and committed to the cause. They have made this event a success. Asante sana wangwana kwa kazi njema mmefanya. This day is an important day kwa sababu ni siku tunatambua wale ambao wamepata shida ya ule ugonjwa tunaita kwa Kiswahili kukuwa na lile shimo lisilokuwa la kawaida la uzazi. Hiyo ni Kiswahili sanifu, Kiswahili mzito. Yes, si nimesema vizuri? Wale Waswahili wako hapa. Kwa hivyo tumekuja kuwatambua na kuambia kwamba tutafanya kazi pamoja ndio muweze kupona. Sisi kama Department of Health tutatembea huko mashinani kwa sababu so many of our people are hiding in their villages. Now the county government of Kisii will also invest 15 million for equipment. And we have agreed with the Safaricom that facility will be complete by the end of this year. Ndio mama waweze kwenda pale wanyora bana no morembe. Ngasa basacha mbara. Bora ruge deregas. Yes. On the same note, the Kisii County government, in the same facility, we have also put aside 100 million to do another block at Guja, level 4 hospital. This will transform health services in the county and decongest KTRH. Tunataka kupeleka services closer to our people. Nimeona kuna Musa hapa. Musa ako wapi? Yule wa Fistula Foundation. Musa bwana, hatujapatana. Nimeambiwa unakaa Kisii. Lazima tutakutoa huko tukupeleka mashinani. Yes, thank you for the support. We shall work closely with you. This is not my day today. Ni siku ya His Excellency Deputy Governor. Sitaki kuongea mambo mengi sana kwa sababu ako hapa. Allow me to, in a very special way, to appreciate the leadership of His Excellency, the Governor of Kisii County, and his deputy for continuously supporting the Department of Health. Your Excellency, recently we worked very closely with you, and we were able as a department to promote our health workers close to 1,600 out of 1,800. This is not a mean achievement. Your Excellency, we thank you because I worked closely with you throughout the day, throughout the night to ensure that we make these people happy. Sasa na nyinyi tumewafanya mmekuwa happy, waja tuende mashinani tusaidie watu wetu waweze kupona. Nyinyi ni wangwana na Mungu awabariki. Your Excellency, I want to request the congregation to remain upstanding as I kindly request you to come and make your remarks.
Asante Waziri, thank you very much for those wonderful and warm remarks. But before I read the speech of His Excellency the Governor of Kisii, Honorable Paul Simbarati, niruhusu kwa sababu ya itifaki nizungumze machache, ndio nikimaliza kusoma speech yake basi itakuwa niko tayari kumwalika mgeni wetu wa heshima katika siku ya leo. Mgeni wetu wa siku ya leo kutoka Wizara ya Afya, wafadhili wote na washikadau katika hafla hii, wale wetu wote kutoka gatuzi la Kisii. Niruhusu kabla sijaendelea kidogo niweze kurecognize wale ambao wamekuwa pamoja nasi, wakiwemo maofisa kutoka ngao ambao wamekuwa ni wakaribu sana katika shughuli hizi na kuhakikisha kwamba tuko na usalama wa kutosha. Kwa hivyo kwa sababu za zingine itifaki uteleza kidogo, tunasema ni pole, lakini bwana commissioner kuja kidogo uzungumze machache. Nimeona kidogo kuna mushkili katika itifaki, but welcome.
Asante sana Deputy Governor, who is also my good friend. We worked with him when I was a DO here. Our guest from Nairobi and all protocols observed. Good afternoon. Ningetaka wale ambao nimekuja na wao, niko na commander, please. Mr. Papai, Mr. Simama, the chiefs who have accompanied me. We are the commander wa AP. You can see I have so many Gawa officers. Please salute and sit. Thank you very much. Mine is very short, and I want to thank the Deputy Governor and even the Governor himself, a good friend of mine, because of the effort he is making in the health center within Kisii County. I've really observed with concern, and I have seen that ni mtu anapenda sana mkuwe na usalama mzuri. Our national government will continue partnering with you. Anywhere you want us, we will partner together so that we improve the health of this great county of ours. I will want to say a few things when I sit down. I've learned from the that was here. You know, I had a friend of mine, a lady who was married. You know, she went to hospital and was diagnosed with cervical cancer. But because she was told that cervical cancer, because you sleep with so many men, she did not want to disclose to anyone, including the husband. And then she kept quiet. After 5th year, the cancer had developed for this stage. Actually, she came to me trying to tell me to help, maybe with the collection of funds so that she can go for the further treatment. So what I want to put across, sometimes it's good we share the problem we have. You know, if those people suffering from fistula could come out, CEC is saying that they will go to the field looking for them. But if you can share with your friend of the problem that you are having, maybe it can be treated early enough and you can have that relief. Anybody can help you. There's a doctor, I don't know if he is here. Last week, a friend of mine, I was talking to him in my office and he told me, you know, I have a very serious flu. I even don't want to sit near your desk. Akakaa huko mbele, kamwambia daktari, kuna dawa mimi hukunywa nikishikwa na homa. It is called Benelin for flu. Kaniambia niandikie. Nikamwandikia. After 3-4 days, he called me akaniambia kumbe DC anaweza tibu daktari. Already flu ilikuwa imeisha. You see? So that is why I'm saying it is good we share of our problem. Me, if I have a little problem, I will share. Because health is very key to our body. Thank you very much and God bless you. DG.
Asante sana Joe. This looks like a drill, moving back and forth, but asante, asante. Joe Mwangi, asante. I knew Joe when we were young people in the office of the president. And again, alikuwa dio hapa kwetu hivi juzi. Sasa amekuwa ni mdosi. Karibu sana Mwangi for coming. Before I make the remarks of His Excellency the Governor, niruhusu tu nizungumze maneno matatu tu kuhusu siku ya leo. Kwanza ni kuwashukuru kwa kuweza kuteua gatuzi letu la Kisii County kuweza kufanya hafla hii katika uwanja huu wa Gusii. Tunasema ni asante kwa sababu ni shukrani kubwa na ni heshima kubwa. Nimejaribu kusikiza vizuri mambo haya ya fistula. Mimi pia sikuwa najua mambo haya and I didn't know watu wengi ni wagonjwa hivi. Lakini nimegundua kwamba ni ugonjwa ambaye unaweza kuleta tatizo, unaweza kuleta shida kidogo na saa zingine kuharibu hata familia. Vile nimeona katika mchezo uliochezwa hapa. Lakini bwana Deputy Director General kutoka Wizara ya Afya, wafadhili wote wa hafla hii na washikadau na wote wa Kisii County Government, tunasema ni asante kwa kufika na ni asante kwa kuweza kuhakikisha kwamba hafla hii imefanyika. We don't take this for granted. Lakini nimegundua kwamba ugonjwa huu unaweza kutibiwa na tena kwa urahisi, ili familia zisiwe na fedheha na shida ama saa zingine kuchekwa. Mumesema ni jambo saa zingine laonekana la aibu, lakini ugonjwa hauna aibu. Kwa sababu ukiaibika unaweza kupata unyanyapaaji, unaweza kupata madharau na saa zingine kufunja familia. Kwa hivyo heshima kubwa ni kusema ikiwa kuna mtu yote ambaye kidogo ameona dalili ya ugonjwa huo, itakuwa ni vizuri kwa haraka kuhakikisha kwamba ameenda katika kituo cha afya aweze kushughulikiwa na kuweza kupona. Tulipozungumza na kupita asubuhi, tumeona kwamba wengi waliofanyiwa utabiti huo na kuangaliwa wamepona. Na tumeona mama wakifurahi na wakismile wale ambao tulipita kwa wards. That therefore means that you can be cured, uwe uhuru na huru kabisa na uwe na furaha. Sawa sawa na ule mchezo wa kuigiza uliochezwa hapa. Na katika watu wetu katika Kenya hii, kama ugonjwa huu nimeona vile ulivyo na watu wanaficha, basi kuna watu wanaweza kuwa wanasumbuka. Tusiwe na aibu, tuhakikishe kwamba tumeingia katika vituo vya afya, tuweze kushughulikiwa na kupona. So that vile mmesema katika mkarara wa leo ni kwamba afya yake mwanamke ni haki yake, na katika siku za usoni katika mwanamke tuhakikishe kwamba kuna maisha mazuri yasiyokuwa na ugonjwa huu, na njia pekee ni kuwa screened na kutibiwa ikiwa umepatikana na shida. La mwisho, wale mnaoshughulikia ugonjwa huu wa fistula, hata sijui vile mnavyoeleza. Mimi nilipoelezwa Bwana Mwangi kuna shimo katika sijui mfuko fulani wa uzazi, mimi sijui Kikisii, nitaambia wakina mama vipi katika lugha yangu. Lakini kwa sababu nyinyi ni wataalamu, tafadhali hakikisha kwamba mama wamefundishwa, enda kwa maredio, enda kwa baraza za machiefs, baraza za madios, muhakikishe kwamba watu wamejua, ili wasiendelee kupata shida hii katika maisha haya ambayo tuko nayo. We are in a modern century. Some of these diseases are actually curable and easy to manage. I thank you one more time for the wonderful gesture you have shown to the Kisii County government, na kuhakikisha kwamba watu wametibiwa, kina mama wametibiwa, ili heshima irudi katika familia. Na vile yule mama aliyezungumza hapa, sijui alifukuzwa, anaishi kwao. You can imagine a young lady, beautiful as she was, she can't go back to her home because fistula ilimletea shida. Lakini mtazame alivyo na afya zake. Sijui kama bwanaka ashamuona, but we hope atapata nafasi ya kurudi na kuendelea na maisha, so that she shapes up our future going forward. With those many remarks, grant me your time to read the speech of His Excellency the Governor for this wonderful day at Kisii Stadium. Good afternoon, ladies and gentlemen. Our chief guest, distinguished representatives from the Ministry of Health, esteemed development partners, stakeholders, ladies and gentlemen. It is with immense pride and honor that I stand before you today on behalf of His Excellency the Governor of Kisii to warmly welcome you to the historic commemoration of the International Day to End Obstetric Fistula. This year's theme, ladies and gentlemen, is Her Health, Her Right, Shaping a Future Without Fistula. It's more than just a slogan. It is a call to action, a mission to restore dignity, promote healthy equity, and reaffirm our shared responsibility to protect and empower women and girls across the nation. We are deeply honored that Kisii County has been selected to host this national event. The first time International Day to End Obstetric Fistula is being commemorated in this region. This moment is not only symbolic, but also a significant step towards addressing maternal health challenges in our region. It underscores our commitment and readiness to be at the forefront of lasting solutions. Ladies and gentlemen, obstetric fistula remains one of the most devastating childbirth injuries. It is primarily caused by prolonged or obstructed labor without access on a timely basis and without quality medical care. The result is not only chronic incontinence, but also deep physical trauma, psychological suffering, and painful social isolation. In the year 2024, 428 women were repaired from the complications of fistulas, and these are those who reported in our facilities. In the last 6 days of fistula camp, KTRH has received more than 50 women for surgeries, which shows that we still have a big burden among our women. Yet, fistula is preventable and treatable. And no woman should therefore have to endure it now or in the future. In Kisii County, ladies and gentlemen, we have taken deliberate measures to address this condition. This includes, one, expanding maternal and newborn health services at all our health care facilities, training and deploying skills birth attendants across our hospitals and health care centers, strengthening referral systems and emergency obstetric care, especially in rural and hard-to-reach areas. Empowering community health care promoters to raise awareness on antenatal care and facility-based deliveries. Promoting girl-child education and working to prevent early marriages and pregnancies, both of which are root causes of the fistula. We are sincerely grateful to the Ministry of Health, UN, FPA, AMREF, the Fistula Foundation, Flying Doctors, and all partners for supporting fistula. Treatment camps across Kisii. These camps have provided free surgical repairs and medical care to women who have often suffered in silence and shame for years. As a county, we reaffirm our strong commitment to expanding access to quality fistula treatment, embracing routine fistula screening and treatment, training our medical personnel in specialized care, ensuring that no woman is left behind due to lack of information or resources. However, treatment alone is not enough. We must go further to ensure survivors are fully reintegrated into society with the dignity and renewed hope. This includes offering psychological support and trauma counseling, empowering women economically through skill development and support for small businesses, engaging community and faith-based leaders to eliminate stigma and promote healing and acceptance. These women are not victims, they are survivors. They don't need pity, they deserve opportunity. Distinguished guests, as we mark this important day, let's remember the fight to end this fistula is not just a medical battle. It's a fight for human rights, for equity, and for justice. On behalf of His Excellency the Governor, I extend heartfelt appreciation to the Ministry of Health, our development partners, civil society organizations, healthy professionals, and the people of the great county of Kisii for your unwavering support and collaboration in this noble cause. Let today's gathering serve as springboard for long-term sustainable solutions. Let it ignite more investment, more action, and more advocacies. Because when we protect our women's health, we protect our community. When we uphold rights, we secure a brighter future for generations to come. Thank you, and God bless you all. With those many remarks, grant me time to welcome our chief guest to rise up and make his remarks. Can all remain upstanding as we welcome him. Karibu, Bwana DDG. Thank you.
Thank you, Deputy Governor. I'll just correct, I'm not the DDG. I work with the Office of the Director General for Health and Dr. Denver Mariga. I'll be reading the speech from the ministry on this International Day to End Obstetric Fistula, which is being held here in Kisii County. Deputy Governor, once again, our dear partners, esteemed colleagues, and also our distinguished guests who have shown up here today. It is both a privilege and a solemn responsibility to address you today as we mark the 2025 International Day to End the Obstetric Fistula, which is being hosted here at Kisii County. The theme for this year, Her Health, Her Right, Shaping a Future Without Fistula. It calls upon all of us to reaffirm our collective commitment to upholding the dignity, health, and rights of women and girls, not only in Kenya, but globally. What we need to know is that obstetric fistula remains one of the most severe and preventable childbirth injuries. Far beyond a clinical condition, it reflects a deep-rooted systemic challenge, inequitable access to quality maternal health services, entrenched gender disparities, and the marginalization of vulnerable populations. While the national prevalence figures remain elusive, due to underreporting and the social stigma associated with the condition, it is estimated that in Kenya we register over 3,000 new cases of obstetric fistula annually. Tragically, many affected women continue to suffer in silence, as they are isolated by shame, socioeconomic barriers, and limited access to medical care. The burden is disproportionately borne by women, mostly in remote and underserved regions in the country, including areas that surround the Kisii County, like Narok, Marsabit, Migori, and Nyamira. As you know, that access in these regions is not yet timely due to transport problems. What have we done so far? In the last 5 years, the ministry has conducted over 5,000 free fistula surgeries together with our partners. We have also intensified community sensitization campaigns, which have been led by the Ministry of Health and also in collaboration with our partners, such as the UNFPA, AMREF, and the M-Pesa Foundation. This has helped reduce stigma, as you have seen here today, and encouraged early health-seeking behavior among our women. Also, the ministry has improved capacity at health facilities, as we've known and as we've heard from the Fistula Foundation, like the Makueni County Teaching and Referral Hospital, which are now equipped to provide routine, basic, and comprehensive obstetric care services, including fistula repair, which we are hoping that now Kisii Teaching and Referral Hospital will be able to take up also on this. Here today, we are also launching the Fistula Surgeons Training Manual, and this initiative will ensure consistency in clinical practice, promote quality care, and ultimately contribute to the elimination of obstetric fistula in Kenya. The Ministry of Health is also proud to officially launch the Obstetric Fistula Routine Services Playbook, which is being done here today, and it's as a strategic user-friendly guide developed to support counties in effectively delivering routine obstetric fistula prevention, treatment, and post-operative care services. By aligning with the national health policies and leveraging existing county health system, the playbook empowers health managers and providers to strengthen service delivery models for fistula prevention and repair, enhance early detection and referral mechanisms, improve community awareness and reduce stigma, and monitor and evaluate outcomes for continuous improvement. The development of this playbook was informed by lessons that have been learned from our partners, practitioners, and communities in Makueni County. It marks a critical step forward by institutionalizing the quality of fistula care and accelerating progress toward a fistula-free Kenya. With this launch, we reaffirm our commitment to ensuring that no woman is left behind in accessing safe, dignified, and timely maternal health care. Asanteni sana, and thank you so much to the Kisii County for hosting this memorable event. Thank you.
Thank you so much, our chief guest, for that very informative and far-reaching speech. At this juncture, as we absorb that information and see how we can get to the book launch, because we are coming to the end, we had one person who would have made this information integrate well with a play from ISF for about 3 minutes, if the gentleman is around, Osoro. This is your chance. The gentleman who was to perform from ISF. Of course, we recognize the weather may have changed priorities, but if he's around, you're still welcome. So from here, we'll be heading to the tent where we are doing a playbook launch, and then we will come to the close of this meeting. But probably just to highlight that event, I'll welcome Karen.
Thank you very much, everyone, to commemorate together with us I want to recognize Johnson & Johnson through the implementing partner JPIGO to have supported the development of this playbook, which was developed with conjunction with the Ministry of Health, and a few partners also who supported this playbook is going to strengthen the service delivery of our patients in this when Kisii is starting routine care. This routine book is going to help them be able to even plan on all the services and how it works. This playbook is very critical for you to be able to plan, be able to know how much money you are going to put into this routine care. You are able to know how do we do awareness in the community, how do we work together as stakeholders within the county, so that when you are starting routine care as a county, this playbook is like mwongozo wa kuwa guide that from point A, you go to point B, you go to point C, and you go to point C. We want to recognize in absentia Makueni County, because without Makueni County, the government through the Ministry of Health could not have developed this playbook. So a clap for Makueni County in absentia. Thank you very much. I think now we need to go down and be able to launch. We have a dent down. Our guest, our Excellency Deputy Governor and DG's Office, Minister of Health, kindly we can go down and be able to launch the playbook that the county is going to use.
Etaya TV, Oborabu Wagusi.
Wanchumo ligeraria witaya TV charagire chinsa isano na ibire chiabono mubaso ekeroto kwarigania semesa ya maya tukumanye asenchera yo wenge na raria yagende tukokoreka ime na isiko yorogongo rwagusi ayarure asembeo no morobelio gende tukokoreka ase geti keri kiagusi aigase omochibosongo abwaserero lituko lioko chengera gosekolinyora lituko lyo mochando fistula wose Obstetric Fistula ogendrete gukorekana kubwaterane wizara yobochenu nyagitari ya KTRH amana babwatani ao bobochenu ase gukwanere mechando ere ase oborwairo bwo gosomo chando yo fistula aborocho yo kwana no mokonyi bwo mo governor we county ya Kisii Elijah Webo asate bire no mochando omobe mochando bobo soko asabasubati na igombi yabasemiwe bamanyigwe buna obokonyi mborororo ase chinyagitari gobono ojo no rumurubiri ogendereterero chitariki 23 tukolie juma asabo bisabonsi bobo chenu korwa ase chinsemo ao igase county ya Kisii obwatera nebyombe ao banyariko bakorwa maigerio nkwarora abasubati bali babwato muchando yo gose bali babwate kurende okaera mbanyariko bakwerera igoro ya makomu ali baeterete oika bakanyoro bokonyi korwa ase chinsemo ao na daraja 2 vision na boigo asinyagitari ya Nairobi women aigaso muchibosongo eyue kokonya baswati ase okoba mana mwancho murigereria ayona ritwa kwareganirie asenchira yo bwenge igo yareganie tumanye ayande alianyariko bakakoreka ase orogongo rwagusi Facebook na bagotonyara buneta ya TV na sensemo ya YouTube ta TV abaga SMS number botambenera TV autoskare igonkwirana ndasege kekerebosyo kumenya mange asobwenge. Mwanchumo ligereria nchini gonkoro kwa Sara Nyarangi ontita nole toko batrana kama kwa sense mwende ye studio nigakoro kwa Ven Muriango tigatu chake buna babwatani au nigo baikira nase getikia ku stadium asomo yegabo kolinyora litskoli nanalio go ikyo moelio omuchando Fistula ime yense ya Kenya banyana babantu nigo basemiwe gutabanengeta bali babwato omuchando yo asekelia bunango ikole omoelio goseno bwato bokonyi chinga kiboigo esegeto ya ruru asebali babwato omuchando yo Fistula wesokia na konyoro bokonyi ase chinyagitari no muchando konyora basubati mono chinga kichiri bako bina wetania kerengo chinga ki bakonyora abana. Abaremi bekemeri yekawa korwase society ya Nyansonge URC location ya Nyagi sub county ya Sametai county ya Kisii nigo baumeranire rero asekelia bakwe murunganeria igoro yoboterenio bobe ase society eyo ekikia ireiro koibwa wekawa ya bokera chingaki nigo batebire buna nigo bataligo chigwancha mangana yobokurumi asekemeri ekyo na igo kogania okwabo no kubaka isiko bali babwateranirie asa mangana yobokurumi anene asekemerie kyo yekawa
egento giate chandire kawa era unde je twanyara chibesa chingi japi ekera twanyara twamanyire ko gomo burukana noro muna bana ndari kabanto bwone baganda ko ndiseri chiombe ayo maka mere ngombe geti tande tera mabere na kiakoba igara kolaki igoyo go kamera mabere geti atare ka somanya na kolaki
mimbu ya mure igo ndigatorata ye yange ninki okorwanirira eyaki yaito obokurumi buru ase factory ito ya Nyamusongo olio mayirenga ngo kurumale erakoleki
ikawiyane mbogole tinere yakiyane ntata gitiko chikurwanirerigwa ngakinde tweke chikagunjo mongina ngwata abana gosomia sukuru ngwata abana bansumbuete nyumba imanye kunyarikana nga umuntu nari busiera umanyita asagu nasagoji
egento kia sumbire ga twajoro mulimi omuya twakanda uko tokonyare twanyana umulimi utete gutoria chikiro cheito abangina bachandegete abasara tuchandeta bakatuchandegete
abantu abo twajorete ngo tokorere gasi bono baikire barambuire mekono bono babesuri chikiro bamende benda chikiro chabalimi bono nyomuntu bade emete 200 ngaya ko au chikiro 1000 aso kere ase ogupima kwaye bono obuno twato ogumikore tochora balimi bali baratokonya
achane kirenga kientambe igensa moyeto ya Nyamusongo twarura bakongu twachora barai nanda barai na obata gitoko toibera ono mwanche toiberu mwanche na toiberu tagatibo ibi ntubuna bichane bikabono nanjere kichane keke na nyore namba wango iganta ketana njembi mekawa moroche nintu arobo moyo gocha so bimekawa etani karongo yunga ebiru
Mwanchumo ligereria korwa bwa sekemerigie chae abwa sebunge ya bobasi tigankoreweka sebunge ya Nyaribali gosa sebunge ya Borabu astokomanya obuna abanyaroka beskuru yoboroso ya Nyaronde DOK imeye ward ya Nyansiongo ibunge ya Borabu nigo banyoriro gosiro akwe bitamba byabachenu korwa soyole neganga yokoligia kirugo kyobo governor county ya Nyamira Walter Chanua na bayigo korwa se abisi yomojumbo Borabu Patrick Bagendi Osero.
Samalieta ngoro ku Helen Nyata era tora ase skuru ya Nyaronde ase tobate program yo koena na sanitary towels asomano moiseke ase nchere yemo yoko monacha na go consider masomayo ntaite kuireneria basike ariba soitio koboko mo MP ito Mheshimiwa Patrick Osero toko moireneria mbiamano no mosike Walter Chanua mbiamano sana asogosiro mwana moiseke na ndochega iga Nyaronde abana ba Nyaronde abana baiseke ba appreciate sana na ndarolirenga abarai ngo consider bale obosafi bwabo na inde nenchera yoko bakiniki masomo
Nchenkoro kwa Madam Irene Nyavoke mo deputy we school ya Nyaronde Comprehensive School nsemo ya Borabu constituency ere ase ward ya Mekenene serit koria rero tore no mogoko abana be school ya nabanyaruka banyoriro bokonyi bwa sanitary pads wetera ase omweshimiwa Chanua your aspiring governor come 2027 Nyamira County. Babwatira nteno mheshimiwa Osero yoro mwempito gotokobera ni ngambia mono na ndinya saba siseni ebyonsi bakora banyakwinyoro mwana munyaruka na inde mbia mono na inde mutinyori botambe.
Mwanchu muligereria buno bakonyo bya gocha sabana banyaruka kero tutigarete asamangana ibitamba byo bochano imeye county yeyo ya Nyamira nerito komanyigo buna aborokia osabaroki wa baiseke kurwase chiskuru chyo boroso ne chechi secondary ase county ya Nyamira nigo banyorira maigeri goro yobo tumekibwe bitamba byo bochano amaigeri akorekana ase skuru yo boroso ya Mobondo eyo gotoke ward ya township ebunge ya West Mugirango county ya Nyamira. Win Mwende no County Commissioner Kenya Girl Guide ase county ya Nyamira yobwaterana amo na babwatani buko bwanchoku ya asogokonya amaigeri ayo yelitukulia lero.
Today we are here to celebrate menstrual health management. We are here to educate girls on how to take care of themselves during menstruation. We are also here to educate them on how to deal with some of stigmas that can rise as a result of menstruation. We are also here to break the taboos that they experience during menstruation. We are thankful for the schools who have sent their learners here. We have at least 15 schools who have sent their learners here. It is a good number, we appreciate. It is a request to all the principals to continue supporting girl child by ensuring that they get this knowledge when it is given out. We usually have this celebration on 28th of every May, every year, but we had to push it to 23rd because of the school calendar activities, which were many. And we are grateful for the teachers who have come. We are grateful for everybody who has ensured that their day is good. Thank you.
To celebrate the menstrual hygiene, whereby to somiria bana igoroya bochenu karawai kirechinga kichabo. Ono nchengo ira nere asante ya which is residential magistrate ya Nyamira Law Courts, Honorable Beryl Juma. Almost Dance Tanyomari from Nyamira Heights, Kembeke Red Cross, aso otokonya goikiraniri tukerere bana igase iraseria ikireiga ndware konyara wikaiga nyotari ase support eno mwatoire.
We're here today at Bomondo Primary celebrating a girl child, the Menstrual Hygiene Week. We are under the Kenya Girl Guides Association, and as far we have learned a lot of things about the hygiene and the stigmas and the taboos that we've always known to be accompanying this menstrual period. So at the moment, I urge the parents to take care of their girls, at least to try and provide the sanitary towels for their children because they always need it like every month. I also request the government and the well-wishers to come in because we have needy people in the society to help them to avail the sanitary towels at school so that they help the girls in case of need.
Twasomire igoro ya abana abaiseke na kibakwerenda ekero bachikorere matukari abo yo boiseke ekero baikira matukayo na beta keire twatebunga twa abana abo bamanye ngamba manyete egente kinkera bamanya nkerororo mbako na kwebisa mbako na kolera bamanye gente kibaka
Omo konyi bubona ibwense Professor Kithure Kindiki nigo aene kiribune serikali nebegete bosio magane y'abakenya bonse asekirenga giyo koreta mauncherio y'amagenderero ime yense ya Kenya aniga yakwana chinga kya koreta ro ime ye county ya Nyandarua asokoro tutubwaga chiu bogendereta sechiro ya Ndaragwa chinga kie chobo igo Kithure Kindiki nigo arorekanire komocha bali bagukwana bobeigoro yobokorori bwa serikali asate vile serikali ya Kenya kwanza nigo bali nekirenge yogo ikirania magenderero nsigo chia saba Kenya.
Lazima tutembee na wananchi wote, wale wako na pesa, wale pesa yao ni kidogo, sisi zote ni nchi moja na sisi zote ni wa Kenya, na hii serikali inaamini ya kwamba uchumi wa nchi utabadilika kwa kiasi kikubwa kama tutaconcentrate huku mashinani, tuanze kuinua watu kutoka mashinani wajiweze, biashara yao ipanuke. So hiyo ndio mheshimiwa anasema tukuje hapa. Tuko na vikundi ya bodaboda, tuko vikundi ya watu ya mkokoteni, tuko watu ya mama mboga. Saa hii sio kesho tuwasaidie biashara yao ipanuke kidogo. Si namna hiyo? Kwa sababu gani? Wale watu nasikia wanapiga kelele huko Nairobi, bana saidia hawa. Kwanza wao wameshiba, wametosheka, wako na mali, watoto wao wanasoma na wako na pesa mingi. Sasa wanauliza, sasa kikundi kipata sijui 100,000, 200,000 itasaidia nini? Nataka tuwaambie hivi, kwa mama mboga, wamama wengi ile stock wanasungusha kwa biashara yao ni shilingi 5,000, 10,000. Huyo mama akipata 1,000 ingine kubwa, 1,000 ingine 10, ikuwe 20, itakuwa muujiza. Mnanielewa? So for a mama mboga, an extra 10,000, 20,000 is a miracle. It is an empowerment because their stock ni ya 10,000. Akipata another 20,000 inafika 30,000. Mama atazungusha hiyo pesa, atamultiply, watoto watasoma na familia itakula chakula.
Manchumo ligiriria na rayo asobwenge hase chinse chiga isano na ibere chabatuke chideke mirongo ibere na inye igoro ye chinse sano ibere chabono mubaso ngwakangambia mono asibali mwato bwatiri gwetera sensema yo mtandao na ndemo gendrete gutubwatia YouTube na baigo Facebook na bali mo gototomere ujumbe gwetera se namba esimi otambe ni gotogwakangambia mono ya bene nyora kero twakurira maya senchira yo baikira no muchikumira na nere yela Mr. Yela cash asomorobelio o light up show litskolia lero lye juma anyale ko baga ko wokia asomorobelio okubwatia kolende korwa semesa ya maya na ende chikoraga chinsa 10 no chikumenyigwa yanda mange asenchira yo bwenge kolendo inyore oneli tuko liyo ko inyora igoro ye chinchira chogokora omochando fistula oyo okoreka asegeti ya Gusi Stadium morobelio kiranwa no mokonyi bo gavana we county ya Kisii Elijah Obebo amona babwatani korwase chinsemo chiobo chano ati abo korwase nyegitali nene ya Kisii teaching and referral igaba subati mwensi ya semore esokie na kolingoliwa ekiagero bokonyi mborororo mchando fistula no mchando bobo soku na ende no mchando otaliumuya yatukorerabo asibono tumira nenya saikaranche chinga kchinde kolende twarobuligereria borobya somo basobono nemerobulyo yeta TV buna erobereire ven moliango ner tobatrana kama korasensemo mwende ye studio chinga kevalina osero no minto Brighton Makori banyara ko babakwene kia babwatranire asamaya asenchira yobwenge chinsa isano na ibere ncheni wankoro kwa Sara Nyarangi on Twitter Brian Achaka nkoro asensemo ya digital boygo Franklin Mayunga nkoro asensemo ye camera.
TV Oburabu Wagusi Omwanchumurigeria Bunita ya TV ntogendrete gukine birengo byobokorera bwito gocha semole ikena kukeirire eta ya TV koene kebuna kiro monto ingotonyorare a sorogongo Rwagusi isako babuna togo gosede kode ya obuna botambe na bukurisika nainde iryo tonyore voigo na bukutumero ujumbe ensemole ase namba yeito ere ase etivi yago inyora obuna bubura butua korenteire nainde ntogendere gokoretera eta ya TV oburabu Wagusi. kwabere gukurigia chibels cha mitumba ao asirigori yoranyare kuikeria mama tefi mitumba neduka embo ukegima asomo chobosongo ya chirenkuma asokonia bells ao asirigori yoranyare kuikeria mabwate bunabono jackets, school bags, mixed bags, hoodies, baby light, house towels, ibikoro tubyabana kwikabanta bane, curtains amone bindebinge. Inyura, ibyonse niko birase kerengo kya grade 1 kuruchise cha Canada, UK, USA amona China. Boigo, nkorobara mayigiri yogo chase bali batagete cha bakoro bonchoreria bwa mitumba. Niko bagotuka Kisii Town Imperial Building, ground floor opposite St. Jude's Building.
Karibu mama tefi mitumba, emesigo yaitogere mesigo grade 1. Emesigo remia na ndi mesigo tokwana na seligo lirirense sana. Ekaroro magani kunyara tole kwa mafundisho ngana kiwone to chake biashara bya mitumba. Naenda abange siko gali nkwebuli balenga nimbwate bibesa bikego nkinda nyare ko bagingo kora. Wakalibishiro asema matefi mitumba. Oti ni chibesa chiriyo bwate. Elinde tunyare ko batowe karansa. Tunyare ko manyanga musigo kyota kere ko bagogo chakera. Oyorumu ya ligoli lili kasi chiriyo bwate. Igobono kera nyare kana ngano bwate chiribusano elibusita tuikaransa nkali ko bolinga inkina akore.
Asamange bakirisimi ase namba 0727081605 gose 0727574835 niko bakwigora amatukonse jeiki mama tefi mitumba obokoryo bya bwa mitumba origene. Ine nogane tego chaka gose kugari yobo tugi bwechingoko engoko company ni gobo bwatego chakire bitutu bibirengo byigoro mono biri tukelimo ebyo byire chanjo bitari go chandwa na marwaire broilers echo chigo kina bwango gweke kilo nenusu asa matukemeronge tato layers chikobeka amagena gweka 330 aso mwaka amagena yokoria ale fresh emesaro ya improved kienyeji buna saso broilers na rainbow roasters kyose aso kubeka amagena boigo enyama nechitwa nigo chigo isalera kunyenya asemetienyi itatuyoka na gweka chikiro gwetani ibere nenusu asemetienyi tato boigo mabwate bichuchu bya improved kienyeji byomotenyo yomo amonendagera ao jechingoko ni bintu byuchirageria buna feeders na drinkers. Asamange batarira bisichabo imeo mochobo songo mwa Mutumbi Plaza mbarabara na main stage ye Kigali gose bakiresime ase namba 0710831806 gose website ya www.engoko.com. Engoko amonaye asobotugi.
Karibu Mwalimu International Hotel Kisii kwa mandhari ya kupendeza. Tuko na vyakula vitamu vinavyopikwa na wapishi waliohitimu kama vile samaki, nyama choma, kuku na aina zote za vyakula vya kienyeji. Conference hall kwa kufanyia mikutano aina yoyote, vyumba vya kulala vya hali ya juu, vinywaji mbalimbali kwenye bar na restaurant, mahali pa kubarizi, mchezo wa pool table na parking ya magari ya kutosha. Pia unaweza fanya booking kwa sherehe kama vile harusi, baby shower, graduation, birthday, sherehe ya watoto na zinginezo. Tunapatikana mjini Kisii, Mashauri nyuma ya jengo la Mwalimu Sacco. Kwa mengi zaidi, tutembelee au kupiga simu kwa nambari 0792